for me in my work, I mostly work with trans folks, a lot of work with trans Latinx folks, and then beyond that, some work with gay cisgender men as well. What we're looking at is the ways in which structural oppression creates vulnerability. It's this, you know, oppression that people might experience based on their skin tone, which there's a wide variety of skin tone within Latinx communities. Like, I look white, right? Like, when I'm in Mexico, I'm just white. And we see that also when we're looking at HIV disparities, that folks who are darker, folks who are also indigenous, folks who are Afro-Latino are more impacted by HIV, have more experiences of stigma and discrimination when seeking care here in the United States, here in the Bay Area, today, yesterday, tomorrow, right? Like these disparities are all tied together and overlapped because the ways in which different structural oppressions interlock and overlap with each other has has such an impact on the everyday experiences of people. So the umbrella terms of Latinx or Latina and Hispanic, uh, definitely there's a lot of feelings from a lot of people within various communities around these terms. But I think overall, people generally tend to identify with their countries of origin, or for folks who are connected to their indigenous roots, they will identify with their indigenous communities. And so I think that uh, we always want to put people in these neat categories, and we never fit into neat categories. So for me, I like Latinx, but I think I like the X because I find it to be disruptive. A lot of people don't like the X because they're like, oh, it's not something that occurs in Spanish. You're really butchering the language, or you're butchering the heritage. And I'm like, well, Spanish is not the language of all of my ancestors anyways. So I'm cool with butchering Spanish. That's all right with me. The broad categories of, Latinx, Latine, Latin American folks, Hispanic folks are really useful when tracking health disparities and when looking to see where disparities exist. If we are able to identify health disparities, then we are able to allocate resources. It ends up being about how is money allocated within the United States, which communities are funded for different types of prevention, treatment, and care efforts. And I think that the issue becomes when we're using this language, sometimes we're excluding Brazil, sometimes we're including Brazil, sometimes we're excluding people from Caribbean countries or Caribbean origins. And so the ways in which we construct these categories determine who gets excluded and included, and also have an impact in our epidemiological data within the United States, particularly looking at the communities that are most impacted by HIV. I think the biggest similarity between uh, folks who have recently immigrated to the United States and Latinx folks who have been born in the United States, maybe for several generations, maybe for all generations that they have histories of going back to, is that we get placed in the same box. We're all placed in the same Latinx, Latine, Hispanic category. In terms of how that impacts HIV treatment and care, it's such a different experience. People who are immigrants into the United States, or people who are not born in the United States, it also differs among those groups, depending on their legal status within the United States. If people have a green card, if people are DACA recipients, where is it that people are physically located within the United States, and how safe is it for people to do something as simple as accessing healthcare? How worried are people going to be that ICE is going to be near the hospital that they're going to, or that ICE is going to be near the, HIV prevention event that they're going to, if somebody does not have a legal status within the United States? They could face deportation, right? Th- That has horrible implications for the prevention and treatment of infectious diseases. It requires so much courage, I think, sometimes for people, or so much commitment to being able to seek treatment, being able to seek care. Even just hearing about discriminatory policies in another state has an impact in, the concept that we might term medical mistrust. No matter what it is that's happening in Florida, it has an impact in what's happening in California, because people are seeing this anti-immigrant rhetoric. People are seeing this anti-Latinx, anti-Latino rhetoric occurring at the same times as the transphobic rhetoric legislation and the homophobic rhetoric and legislation are all being enacted. Even within the so-called sanctuary cities, when people are interacting with health systems, when people are interacting with systems that collect their demographic data, that know where they live, that know their name, that have a way of getting a hold of them, for many undocumented folks, is a source of trauma, is a source of fear, is a source of how is this information going to get back to me? So in general, there can be silence, shame, and stigma around sex and sexuality, sexual orientation within different Latin American countries and Latin American contexts. People are told from a very young age that these topics are shameful, right? That this is not something that we should discuss. And it is really ingrained within us, right? Talking about sexuality with our elders is something that we don't do. And I would say this is not limited to just Latinx communities, but particularly for for Latinx context. To me, it's tied to colonization, right? It's not something that the original peoples from which many of our communities descended had as a source of shame, right? And now sexuality is a source of shame. It is a source of, this is something to not be talked about. And we know that that creates HIV risk. We know that just has an enormous impact on the sexual health of people. I do really see the impact that faith or religiosity, family and familial connections, and then community connections have within Latinx communities, and the impact that that has on HIV. We know, for example, that when we're looking at faith and when we're looking at religiosity, it can serve as a protective factor against negative health outcomes. Having access to religious traditions that people feel are affirming and are accepting of them is a protective factor. On the flip side, we can see that when those faiths might be a source you know, of shaming people around sexual orientation or gender identity, that protective factor sort of evaporates, and that becomes, that might become a force that might place people at increased risk for HIV, with that concept of shame. Similarly, with families, we have concepts of familismo, which is really some parts of it are really great, and some parts of it are very patriarchal, right? That the family needs to be placed above everything, but then these patriarchal notions of what is a family and who in a family gets sort of prioritized is also encompassed within that. But what we know is that family acceptance is a hugely protective factor for all people. But I think especially for Latinx communities where family plays such a large and significant role within our lives.